Welcome back to Informal Training Solution. Today I shall be discussing the female gonads and the male androgens, of course, plus the contraceptives or the contraception. Of course, in a short presentation. Now, of course, we know that the ovaries in the female produce the sex hormones, and of course, these ones are produced at puberty up to menopause. Now, of course, we know at puberty the hypothalamus begin to produce the gonadotropin-releasing hormone, which stimulates the FSH and LH from pituitary glands. In turn, this one stimulates the release of estrogen and progesterone in the ovaries, which control the menstrual cycle. Ensure you know the menstrual cycle. After this presentation, you can go again on YouTube and search the menstrual cycle. They will show it to you very well. And of course, we know that small amounts of estrogen cause breast enlargement, and then of course later on, larger amounts are the ones which cause secondary sex characteristics such as the breast enlargement, and of course they alter the fat distribution, forming the female contours, and then even other secondary sex characteristics. Now, let us look at estrogens. Of course, the natural ones have the estradiol, estrogen, and estriol. The synthetic ones, which are commonly in contraception, we have the ethinyl estradiol, mestraniol, and quinestrol. We also have the synthetic non-steroid ones. I think I forgot an example. Now, of course, as I said earlier, most hormones act through the nuclear receptors to activate or deactivate transcription, the JAK and STAT cytokine receptors. What are the uses of estrogens? Of course, they are used in hormonal replacement therapy for postmenopausal women to prevent osteoporosis, and of course, they are used as a component of hormonal contraception, especially ethinyl estradiol with progestin, as we shall see later on. Let's look at the progestin or the progesterone. Now, of course, the synthetic examples we have megestriol, hydroxyprogesterone, medroxyprogesterone, and dimesterone. We also have others such as the norethindrone, etonogestriol, levogonestriol. Now, these are the nortestosterone derivatives, which are also common in contraception. Nogestimate. This one very important. Of course, we know that medroprogesterone is used as a long-duration, long-acting injectable contraceptive. We know Depo-Provera. This is also called this. Megestriol, nogestimate, all these ones have no estrogenic effects, and they are used in contraception, as we're going to see in the preceding slides. Of course, the uses hormonal contraception either alone or in combination with estrogens, and also they are used in hormonal replacement therapy. In case ladies can't produce these hormones in order for them to have the secondary sex characteristics, you can use them. Now, let us briefly look at hormonal contraception. Of course, it is either in a combination or alone. Now, the combination one, it contains estrogens and progesterone. We have an example in the next slide. They are subdivided into monophasic. Now, with the monophasic, they have a constant dosage of both the estrogens and the progesterone. However, in the biphasic and triphasic, they have varying amounts of each. The components of estrogen and progesterone, they keep varying with time, and even they are labeled. I'm sure if you look at that package in the pharmacy, the one you have, you can know what I'm talking about. We have those ones which have the monophasic constant dosage, or the bi or triphasic. We also have the continuous progesterone only, and of course they are either oral, as oral tablets, injectable, skin patch, those ones are used as skin patch, vaginal ring, intrauterine, and of course the implanon or the implantable form, which is put under the skin. Of course, now the effects of this hormonal contraception, we are having the inhibit ovulation, and of course the increased secretion in the uterine tubes. Of course, hence decreasing motility. Of course, there are other effects. Remember, this is a short presentation. If you go on reproductive health website, you can get others, or even all other websites. Why I'm saying reproductive health, because for them they deal more in this and have good information. Here is examples of the combination which the hormonal contraceptions we have in pharmacies. We have ethinyl estradiol, which is plus levogonestrol, ethinyl estradiol plus norethindrone, ethinyl estradiol plus norgestimate. I'm sure all these ones you know them, they are there. You may be having them in a pharmacy. We also have the progestin only, levogonestrol alone, etonogestrol or the implanon, which is put under the skin. We also have the medroxyprogesterone, or what we call the Depo-Provera. Now you can always pause, or you can refer to this one later on and you understand them better. I'm sure when after you have read them, you can go in your notes and read more, or you can contact us, or you can refer on to other websites. We also have the emergency pills, the postcoital contraceptives. Either you have progestin only, that is levonorgestrel 0.5 milligrams, there are 2 tablets, or we have the ethinyl estradiol, this one, or you can have a combination. You can have norgestrel and ethinyl estradiol. Others can include mifepristone, which is an antagonist at progesterone. This is also a mineralocorticoid antagonist. We are going to look at it later on, a glucocorticoid antagonist. Let's look at the selective estrogen receptor modulator. Now, these ones, why they are called selective? Because they are either agonist or they have beneficial effects in some tissues, such as bones, brain, liver, and also they are antagonists in other tissues, such as if they are used in carcinoma and in such as in breast cancer or endometrium. They can act as antagonists. Because now tamoxifen is used in treatment of hormone responsive breast cancer. Of course, we know that because of and has also antagonist effects in bones. Hence, can also be used in osteoporosis in menopausal women. You can refer to these ones further because I did not talk about the side effects of these drugs. We have raloxifene. This is used in menopausal, in osteoporosis, in postmenopausal women. You can go on those apps you have on your phone. It tells you searching tamoxifen, you can get more information. We have also the antagonists, the estrogen antagonist. We have the fulvestrant. Fulvestrant is a pure estrogen antagonist. You can get an objective talking about this one. And in all tissues, and it is used in treatment of breast cancer. Because remember, we have high hormones which are being produced in cancer. And in patients who have developed resistance to tamoxifen. We also have clomiphene. This is an ovulation-inducing drug. It is used to induce ovulation in anovulatory women who also wish to become pregnant. This one is common. It acts by selectively blocking estrogen receptors in the pituitary, and again it reduces the negative feedback of FSH and LH, hence leads to increased production of FSH and LH. And of course, we know when these ones are produced in large amount, they will stimulate the ovaries to produce estrogen and progesterone, hence can increase fertility. Let us look at the antiprogestins. This one we have mifepristone. Mifepristone is orally active steroid antagonist, and again it is also a glucocorticoid antagonist. It's again used in contraception, as I've said above. Now the side effects are very important. Let's look at the male gonad hormones, or the androgens. Of course, these ones are produced. The male androgens include testosterone and estradiol produced in testes. They are under control of the FSH, and the LH. The LH is one which stimulates the production of Leydig cells. stimulate the production of testosterone from the Leydig cell. Now, testosterone is required for sperm production in seminiferous tubule. Now, testosterone is converted into the active dihydrotestosterone by the 5-alpha reductase. This one is very important to know because most of the drugs which I'll talk about later on will be inhibiting this enzyme. The effects of testosterone, of course, we have the growth of the penis, scrotal, seminovesical, skeletal growth, rings. These are the secondary characteristics, the vocal cords. And examples of the natural one, testosterone, and also the synthetic one, methyl, testosterone, fluomethyl, fluoxemestrione, all these ones, the oxandrolone. Now, in case I pronounce them poorly, be forgiven. Of course, now, these are the ones again which are used in anabolic, in bodybuilding, and that's why they are not used. They are they are banned in sports because when you use them, you gain the energy. These are one of the drugs which are banned in sports. Of course, they are used as hormonal replacement therapy in men or in adolescents who have problem with hormones. Available as tablets, parenterals, and gels. These drugs. Of course, what are the inhibitors of testosterone or the androgens? Of the steroid inhibitors, we have ketoconazole. Of course, this is an antifungal, an inhibitor of adrenal and gonadosteroid synthesis, but has no effect on ovarian synthesis. And is used in men who have gynecomastia. We have spironolactone. This is a potassium sparing and diuretic. It competes with dihydrotestosterone for androgen receptors in target issues, and again it is used in treatment of hirsutism in women. I hope you know what this one means. The beards, hirsutism. This one. Finasteride. This is an inhibitor of 5-alpha reductase which converts testosterone to active form. It is used in treatment of benign cancer or benign prostate BPH, benign prostate hyperplasia, and of course hirsutism. It has a short half-life. Others which are used, we have dutasteride. This has a long duration of action. Now the other drugs which are androgens have futamide and cyproterone. Now this has been a short presentation. You can always refer to it later on in your free time, because the more you listen to it, the more you get the energy to go and read and try to get these things. You can refer to other presentations which we have in endocrine for more information, or you can contact us for more information. I always remain Wilson from Pharma Trading Solutions. Like our channel, subscribe to us, leave a comment on how we can improve, and always contact us. We shall always reply. Thank you very much.